Hello, good afternoon from Thailand. Uh, I'm working for migrants health in Thailand. So I'm from the organization named SMIU. SMIU is an organization started to help the migrants here since 1986. At that time, especially with malaria and also antenatal care. And SMRU started its TB program since 2019. So here I put a small map. Thailand and Myanmar are both from Southeast Asia, and they have a quite long border. Let's put next slide. So our target population is Myanmar migrants coming from Myanmar to Thailand and living in remote villages. They have a very difficult situation to visit the health facilities, especially because many of them are illegal migrants, and they have travel restriction, and they are not included in the health system as well. So they have a difficulty to check, to get screening for TB and other health problems as well. So before we receive CAT4 system, when we go out to the field, yes, we can find people, Myanmar migrants there. But if we want to do test X-ray, it is very difficult for us because to bring them to the clinics, to send them to the radiology facility, it has a lot of difficulty. So actually, we are doing both active and passive case finding approaches. We are going to the field as well as we are opening TB clinics and taking care of the passive cases as well. Now, we use CAT4 machine for both field screening and also we use in the TB clinic. We have two TB clinics. One is in the Thailand side on the border, and other side, Myanmar side on the border as well. Elizabeth, please next slide here. I just show here the photographs of the migrant community living in villages. Most of them are workers working in the farm. So they are living like small houses in cluster. They have business owner. Most of them are restricted in this environment. They are working and they are living here. Next slide. So we started this field screening, going to the villages by the end of 2019 until middle of 2021. And there we use this kind of algorithm. We are asking them with questionnaire, with symptom checklist. And we did chest X-ray screening for all participants using the CAT4 TB. And for the presentive cases, what we define a presentive here is if they have symptoms and or chest X-ray abnormality, we assume as they are presentive, and we did sputum AFP microscopy and gene expert test. And we use often also radiologist opinion as well. Next slide. So this is the symptom checklist we use. So total 6 symptoms: fever, weight loss, cough, hemoptysis, night sweat, tiredness. If they have any one of symptom here, we will do sputum microscopy test and gene expression test as well. Next slide. So it is the screening and diagnosis pathway. Someone has symptom and or chest X-ray abnormality. We use the 3 sputum samples. 1 spot sample and 2 early morning sample, gene expression test and radiology opinion. And also we review with the CAT4 score as well and reach a TB diagnosis. Next slide, please. So far, next slide, please. Yes, here the image here is how we do TB screening in the field. And so far we screened more than 1,000 people in the field with CAT4 TB. They are migrants working in the farm. We are going to the farm to do the screening. Among these people, 200 people, it is about 17% is presentive TB cases because they have symptoms or chest X-ray abnormal findings. So 10% of them has abnormal chest X-ray finding. Next slide, please. Hello. Next slide, please. So what we found in the screening is among these 1,000 people we screened, 16 TB cases we received. It is just 1%. Among these 16 people, 3 is a smear positive pulmonary TB. When we check the CAT score, they have 48, 87, and 91 respectively. So among 13 people among these 16 patients, they are smear negative pulmonary TB. For these 16 people with TB diagnosis, the median CAT score is 70. And what I not described here is for the people not diagnosed with TB, they have a CAT score median 43. For these 16 people, among these 16 people, 14 people have CAT score more than 50. The other 2 has a CAT score of 50. And 14 people among these 16 people are actually asymptomatic. They are quite healthy. They look quite healthy. So it means that because of CAT4 chest X-ray, we can detect early TB as well and can start anti-TB for them. So these 16 people we brought to SMIU clinics. There, it is a facility-based TB residential. They live there until at least 6 months to finish their TB treatment. So we have to stop the free TB screening in June of this year because of COVID situation in the area is getting worse, traveling restriction getting increased. Also, the places are locked down. Now, COVID vaccination started. COVID situation is getting a little better. So we will go to the field again to continue field TB screening. Until now, we can just do 1,000 people to be screened with CAT4 TB. So in next coming presentation, maybe I can show more. Here I summarize with graph of the our results. Total more than 1,000 people, 200 people are presentive TB cases. Out of them, we received 16 people with diagnosis. And among them, 30 is SBR-TB, SBR-positive TB, pulmonary TB, and other 13 is SBR-negative pulmonary TB. Next slide. So our future plan is to go to field agreeing to continue field TB screening with CAT4, and we will use the radiologist opinion more, and to increase use of gene expert tests, and also we will use TB culture for present with TB cases as well. It is our future plan for research purposes. Thank you. That's all my presentation.